Evaluation of the performance and tolerance of the combination of a hyaluronic acid-based filler with tri-hyal technology and a skin biorevitalizer on skin aging parameters. Facial aging is a complex process that involves numerous structural changes over time. Inner layers of the skin experience a decrease of fibroblasts activity and a reduction of extracellular matrix components such as hyaluronic acid collagen and elastin fibers. These structural changes cause loss of radiance, loss of skin density, loss of firmness and elasticity, loss of facial volume, appearance of first wrinkles and fine lines. To correct these effects, most practitioners are used to treating their patients with dermal fillers and biorevitalizing products, but not in the same skin layer. For the first time, FillMed has proven the efficacy and safety of an exclusive combination of two medical devices. Injected in the same session and in the same skin layer, it addresses both wrinkle correction and improvement of skin quality parameters. Nctf 135HA is a complete biostimulating solution formulated with 60 essential elements. All these ingredients constitute an optimal cell environment, providing the dermis all it needs for a proper functioning with a physiological and natural stimulation of fibroblasts and induction of new collagen. It continuously redensifies the dermis, inducing a tightening and smoothing effect on the skin. These ingredients also bring an instant and visible glow. Nctf 135HA is combined in the same session with a hyaluronic acid-based filler, Art Filler Fine Lines, or Art Filler Universal, with two different rheologies, adapted to the patient's needs thanks to the innovative tri-hyal technology based on an optimized cross-linking of very long chains and long chains of hyaluronic acid with a homogeneous incorporation of free hyaluronic acid. A multi-center study demonstrates the anti-aging efficacy and the safety of Art Filler combined with Nctf 135HA injected in the same session. The article was published in the Clinical, Cosmetic, and Investigational Dermatology journal, Dove Press, in April 2023 by 8 international investigators. This prospective and multi-center study was conducted for 4 months in 5 centers in France. 100 healthy subjects were enrolled. Each subject received injection of Art Filler Fine Lines or Universal combined with Nctf 135HA using a cannula. Depending on the patient's aging grade, the doctor decided to inject 1, 2, or 3 vectors on each side of the face with a fanning technique and by a single entry point. Vector A with a unique entry point by the zygomatic arch. Vector B with a unique entry point above the mandibular angle. Vector C with a unique entry point beside the oral commissure. After the injection at day 0, each patient was evaluated during 3 follow-up visits at 1 month, 2 months, and 4 months. During each visit, different assessments were performed. Based on the Skin Radiance clinical score, a statistically significant improvement was observed after the injection protocol. The Skin Radiance clinical score improved by 61% after 4 months. 96% of the patients were still corrected by at least 1 point at the end of the study. A significant and immediate improvement of wrinkles was observed in different areas evaluated by Bazin numerical scales as early as 1 month after the combined injection protocol. The correction is continuous, and scores stayed improved until the end of the study. At 4 months, cheek folds are still improved by 55%, marionette lines by 34%, nasolabial folds by 30%, and upper lip wrinkles by 48%. In addition, a positive distance lifting effect has been observed for the 64 subjects with no direct injection in the perioral area, Vector C, with improvement of nasolabial folds, marionette lines, and upper lip score. This positive collateral effect of vectors A and B remained significant even 4 months after the single injection, with an improvement of nasolabial folds by 28%, marionette lines by 31%, and upper lip wrinkles by 32%. All adverse events were minimal and disappeared within a few days after the injection. No serious adverse event was reported during the study. A significant satisfaction rate based on the GACE, Global Aesthetic Improvement Scale, was reported by subjects and investigators with respectively 86 and 98% at 4 months. This combination of dermal filler and biostimulating solution demonstrates a global anti-aging performance with an immediate and continuous correction of wrinkles, restoration of the lost volume, and an improvement of skin quality. The specific injection technique also provides an additional distance lifting effect. This study attested of the excellent safety profile and a high satisfaction rate for both investigators and patients by combining Nctf 135HA and art filler.